Out for a 70-year-old male subject complaining of chest pain. While we're going en route to our patient, we're going to go ahead and kind of see what kind of weather we have today. Today is a beautiful spring day, ambient 60 degrees with a little bit of wind coming out of the southwest. So no real concerns on that front. As we're driving up to our scene, we notice that the house is in a nice residential area, lots of nice well upkept condos. Get to our patient's address. House looks pretty nice. There's no stairs we have to be concerned about falling. There's no debris or anything like that in the yard. There's no animals that we see. So as we walk up to the house, house looks very nice. We knock on the door, say hello. This is, Mid-State EMS. We're here for a call. As we walk into the house, first thing we do is we look around and we notice that the house is very well kept. Smells of a nice fresh linen scent. We don't notice any pets or anything like that. As we keep advancing into the house, looking for additional ways of egress in case something negative were to happen. Partner, do you see scene hazards or anything like that?
Not at this time.
All right. So we take our standard bodily fluid precautions. We have our gloves on. We have eyeglasses to protect our eyes. At this time, this should be sufficient. As we come up to our patient, some of the things we're considering is our BSI. Obviously, we've made sure our scene is safe. This is likely an NOI at this time, nature of illness. We are looking for the number of patients, which appears to be 1 today. We have additional resources on standby. If we need it, we can always call for flight. At this point, we're not going to take any cease-minded precautions. So when we come in, talk to our patient, look at our patient, we have our general impression. Looks like a 70-year-old male subject clenching his chest. Appears to be cool, pale, and diaphoretic. As we get closer, say, hello there, sir. My name is Jordan with Mid-State EMS. How are you doing today? What's going on? And he responds telling us that he's having some crushing chest pain today. Because he's talking to us, I know his airway is patent. He appears to be breathing about 16 times a minute, and we're going to go ahead and get lung sounds. My partner is going to assess his breathing just to make sure they sound clear. It looks like he's breathing adequately, normal respirations. And for circulation, we're going to go ahead and check a pulse, radial pulse, and feels like it's regular. It's within normal limits. His skin is cool, it is pale, and it is diaphoretic at this time. So
Lung sounds are clear.
lung sounds are clear, perfect. So as I talk to the patient and interview the patient, my partner is going to go ahead and hook up to the monitor. We're going to get a 4 lead, followed up with a 12 lead. Because he's got chest pain complaint, we're going to follow up aspirin if he's not allergic to it. We're going to end up getting a SpO2 on him as well and treat from there. So, hello sir, what's going on today? You have the chest pain. How long has this been going on for? And he tells us that it's been going on for about 20 minutes. What were you doing when this started? And he responds telling us that he was outside working on some lawn cleaning when he started getting this chest pain. So it's currently his signs and symptoms that he has. He's got crushing chest pain, cool, pale, diaphoretic, just not feeling right. Do you have any allergies today, sir, at all, or at any point? He responds to sulfa medications. He's got allergies. Any current medications that you take? Then he goes ahead and responds to us saying that he takes metoprolol for high blood pressure, which he is compliant with. He also has gabapentin for his diabetes. So any other past medical history that we should be aware of? Have you ever had cardiac issues, respiratory issues, diabetes, things like that? He goes and tells us that he has a history of high blood pressure, and he has the history of type 2 diabetes. Other than that, he has a pretty clean bill of health. When was your last oral intake? He says it was earlier this morning, prior to going outside and working. It's about 9 o'clock now. He ate about 8 at about 8. And then events leading up, he told us that he was working outside when he started getting this chest pain. So onset happened about 20 minutes ago. I'd ask him what kind of makes this worse here, what makes it better. Patient's going to go ahead and tell us that the pain is better when he's resting and he's not working. When he starts working again, he starts getting that kind of chest pain, crushing feeling. How would you describe that pain? He described the quality as a crushing chest pain. Does that pain radiate anywhere? And he tells us that it radiates down his left arm and up into his jaw. And then on a scale of 1 to 10, 10 being the worst pain you ever felt, and 1 being almost no pain at all, where would you rate your chest pain at? And he goes and responds telling us that it is a 8 out of 10. So it's been going on for about 20 minutes, 8 out of 10.
I have some vitals for you when you're ready.
All right, what is our vitals?
Heart rate's 70. Blood pressure is 150/90. SpO2 is 94%. Respiratory rate 16.
All right, and then we have our 12 lead, which showed a anterior ST elevated myocardial infarction. We're gonna go ahead and start getting him on a 4 liters per minute nasal cannula with end-tidal CO2 capability. We're gonna go ahead and give him 324 milligrams of aspirin right away. We would be extricating this patient out, so this is going to be a high priority transport for us. So we would want to be getting him out to our truck right away and getting him to a cath lab as soon as possible. We would go ahead and activate the cath lab as well, cath team, to get them prepared. We're about 10 minutes away from our cath lab, so we're not going to be utilizing a helicopter today. So at this point, we would have moved the patient into our ambulance with our stretcher. We want to have him do as minimal amount of walking as possible. We want to go ahead and give that aspirin while we're moving. So at this point, like I said, we have an anterior STEMI that we have diagnosed in the field. We've activated our cath lab, and we're getting him moved. So like I said, when we're moving, we're getting him this aspirin chew up, making sure he doesn't have any allergies, make sure he hasn't had any like stomach ulcers, bleeds, and things like that, which he hasn't, so go ahead and have him chew these up for me.
There's 4 of them here. Just go ahead and chew them.
All right, so I know it kind of tastes a little gritty, but you have to swallow them, and unfortunately I can't give you any fluid to drink with that. So after we've moved him and we have him in the ambulance at this point, we're going to go ahead and start an IV, and we're going to also, as soon as we have that IV secure, we're going to go ahead and give him some nitro. We're looking at 400 micrograms of nitro sublingually to help with some of that cardiac perfusion. Hopefully we can open up some of the vasculature to help feed the heart oxygen and kind of help with a little less demand on the heart. So while we're doing that, I'm just going to keep asking him how he's doing, how everything feels. And things haven't really changed, so we haven't gotten the nitro on board yet. Just going to wait for our IV. Well, with his blood pressure being as high as it is, we can go ahead and spray him with the 400 micrograms. So I'm going to let him know, hey, this medication that I want to give you is going to make you feel like you might have a bit of a headache, could make you feel a little nauseous, make you feel a little dizzy, but this medication is going to help with that chest pain. I'm going to make sure he doesn't take any other nitrates today. He hasn't taken anything, and he also is not taking Viagra's, Cialis, things of those natures.
Clean.
Yep. So we're going to go ahead and have him lift up his tongue.
And you're going to feel a little poke here.
All right, I'll wait for you.
Okay.
All right, 20 gauge in the right AC. So if you lift your tongue, I'm going to give you a little spray here. All right, so we sprayed the nitro. This is going to help with that chest pain. So because we did it before 12 lead, we're going to wait 2-3 minutes and go ahead and get a post 12 lead after the nitro to see if we have any cardiac changes at all. Hopefully we reduce his chest pain with this nitro. At this point too, we can go ahead and just keep a saline lock. We do not need to give fluids at this point unless his blood pressure were to drop below, get too low or starts having altered level of consciousness effects because of the nitro, which he doesn't. We're also going to go ahead and draw up 100 micrograms of fentanyl for his chest pain. So far we've gotten the oxygen on, we have the nitro in, and we have the aspirin. So fentanyl is going to be our next setup.
All right, you said 100 mics?
Yep.
50 mics per ml. I'm going to drop 2 mLs.
Perfect. So 2 mLs, 100 micrograms?
Yep.
Perfect. Has the right medication, right drug, right time, right
Administering
dose.
fentanyl.
Perfect. And it wasn't expired as well, so that's positive.
Followed by a flush.
Alright. But she said he did not have any allergies to these medications, so again, hopefully this will help with your chest pain here, sir. So we'll go ahead and spend a couple minutes. We can go ahead and check a new 12 lead to see if we have any EKG changes.
Okay.
And do we know any EKG changes at all?
Nope.
Nope. Okay. So, sir, at this point, I'm thinking that you're having a heart attack. So we're trying to get you taken rapidly, because you are a high priority patient, up to the cath lab so they can help with your chest issue that you're having, your chest pain. We'll go ahead and get a second set of vitals.
Okay. So right now we have a blood pressure of 135/80, heart rate still 70, and our SpO2 is up to 98%. We do have an end tidal of 40.
Perfect. So we're doing just about everything that they would be doing at the hospital for you right at this time. So we're only a few minutes away from our hospital. Do you have any questions at all for me at this point? Which, I mean, the patient's probably going to have a bunch of questions, but fortunately for us today, he's not going to talk much. He's just stressed out. So on a scale of 1 to 10, we'll kind of reassess you. You know, where's your chest pain at now, and how does it feel? And the patient goes ahead and responds to us that it's kind of still like a crushing, more of a dull pain now. It's not as bad. We went from an 8 out of 10 to about a 2 out of 10 with the nitro spray and the 100 micrograms of fentanyl. And now that we're en route to the hospital, we're going to go ahead and hang our nitro drip, which we would do 10 micrograms a minute or 1.2 mLs an hour for this patient. This is going to be a little less harsh on the patient's body. That's why we're using the drip over just spraying with 400 micrograms at a time. So we'd hook this up and we'd hang this. You just want to hang this over on our fantastic line over there. We could put this on our pump, which would be more effective for giving this to the patient. Otherwise, at this point in time, we'll continue doing serial vitals every 5 minutes because he's a high priority transport. We would continue to make sure that his vitals all stay within normal limits, and we would go ahead and try to reduce his chest pain and keep it reduced with our nitro. If it starts to increase, we can always titrate up, and if it starts to get his blood pressure too low, we can always titrate down on our nitro drip. But other than that, we'll make sure that he gets prepped for the cath lab. We can shave him in his groin region if we needed to. Other than that, should just get him to the most appropriate facility at this time.